But yeah, let's talk about some international medicine and stuff.
Okay, cool.
Ladies and gentlemen, welcome back to the Dr. Burchett Show. This is episode 3 with Talia and Rick.
Yes.
Nurse practitioner Talia,
Yes.
Dr. Richard Moberly II, a med school class of mine. Let's talk some international medicine stuff, because I know that you and I kind of connected on that in med school. And you met the wife here
Me.
in Haiti,
Yes.
which I'm going to use as a model for my own.
Good luck.
I recommend it. It's where I found my wife.
So let's talk all things international medicine.
All
Sounds
things.
great.
From ladies to helping people. And you may have noticed we busted out the rosé in the process. This is going to be a great podcast.
We'll learn all the things.
What got you guys into that? What was your first time?
Well, so I think it's something I've always been interested in.
Can you think about what got you interested in it always? Early memories?
I mean, I want to say like something as ridiculous as seeing those like commercials on TV of starving children and
Totally.
all of those things.
You could spur your conscience a little bit.
Yes, and I think I kind of always, pictured myself doing something like that, but I didn't really know in what capacity I would be, doing that.
Right?
Yeah.
I remember when I was in Catholic grade school, Dr. Quinn was a local ENT. And one day he, at church or whatever, showed slideshows of cleft palate stuff. My mom was a nurse, and I was like, that is the coolest thing ever. I think that was like one of the seeds, for sure.
Yeah, for me it was, I was in high school and I went with a local pediatrician there from Grand Junction, Colorado, named Craig Sporing. He was a gentleman who went to Tegucigalpa, Honduras, Honduras. He went there every few years, and I got to go my senior year. And I mean, anytime someone first sees developing world poverty, it impacts them greatly. And I think a lot of people have had these experiences. When you talk to anyone who's really seen it and visualized it, there's the first time you go, it has this huge impact on you. And for me, that impact is in the setting of a doctor volunteering and treating lots and lots of people. And I was like, I want to be that guy. I think what he's doing is great, and all these people are being treated because of his will, and he decided to do this, and then these people were better. And I thought that was such an amazing thing that he did.
Awesome.
That's what really led me to do the same thing.
Did you want to be a doctor before that?
I thought about it, and that really kind of cemented it in for me. So international health is really what got me into the doctoring gig.
How about you?
Well.
Besides looking for handsome men with amazing radio voices, which clearly.
I kind of had the opposite. Well, not exactly the opposite, but I think I just knew I was kind of a naive kid entering college, and I really didn't know what I wanted to do. But I always had this picture in my brain. And then, as I kind of slowly started to...
What was that picture in your brain?
Just being able to, go, abroad, and, I was very naive. I vision of, helping all these people, and...
I like it. Why did you kind of...
Well, no, it was cool, and in my head it was, I wanted to do something like that, but I never...
It was kind of romantic,
yes,
but that's what they are in the beginning.
And it never really, even occurred to me to go into anything like medicine or nursing or anything like that. And then I don't even know when exactly, but I think at one point I was like, wait a minute, if I go to one of these countries, what am I going to be doing there? I thought about going, being a social worker, which is a great profession, and I majored in a couple different things in college, and then I was like, okay, but if I want to go now, because I kind of did, I was like, well, what am I going to do? So, and then I was like, well, I guess I could go into nursing. And so I did switch my major in college, and, it was totally, I didn't even know what a nurse was at the time. I had, zero idea.
You got kind of lucky. You fell into this stuff.
I totally fell right into it, and, I got where I wanted to be, really, so it was...
I think people's
Pretty cool.
stories are fascinating, you know,
Yeah.
especially when you talk about this. I mean, I don't know how many events in your life were as impacting and profound as you taking that trip with that doctor and saying, I want to be that. You know, that in your brain, that put something that stuck there for your whole life. That was a huge deal. I think in our lives, you know, we all have a handful, not 100. There's a handful of super impactful moments. And then we say to ourselves, I'm going to do that. That's what I want to be. And it really shapes your future. I think it's fascinating. There was a lot of, you know, I think about, there's a lot of them for me. I wanted to learn Spanish because I thought it was cool in high school. You know, just like, I'd be cool if I could speak another language, you know. My experience of learning Spanish was the opposite. I always felt inadequate, like I didn't know enough, I didn't know what they were saying, I should know more, and all that stuff. That kind of led me, I want to learn Spanish, so I'm going to go to El Salvador for a summer. And then I'll come out fluent, which totally didn't happen. I went there, and the family basically laughed at me all summer long when they would ask me questions like, hey, how are you doing? And I'd be like, sí, no. You know, like I didn't answer them inappropriately. I made some progress, but didn't learn it. But I went down there and had an experience that changed my life. And out of that, I'd always wanted to be a doctor, but out of that, I was like, wow, there is some wrong shit in this world. You know, we need to work for justice. We need to make this world a better place. What a better way to do it than to be a doctor, you know, to actually be able to help individual people, to make a difference, and then to be a part of movements, you know, to lead in a direction of really making the world a better place. And so that was where a big seed was planted for me. Did a whole bunch of other stuff, you know, after. Okay, let's talk about, can you think of like, in your international medicine work, can you think of like some impactful moments with patients or with encounters that come to mind and that have stuck with you?
I mean, I think that, you know, some of the things that you often hear about international medicine are the success stories. So I'm going to pull out a downer on this one. So we'll miss that part. You know,
okay.
I remember there was this time where we were in Zimbabwe. I was there with my
Who's we? Or is
Talia with you? This was pre-Talia.
Pre-Talia.
This was with
PT.
PT.
PT and AT.
Exactly. I was with my current partner, Jack Klein, who's also a family doc, as well as a registered nurse at the time, Nikki DeLisi, and we were there in Africa volunteering, and we were in the pediatric ward, and there's a child there, and there's some traditional medicine practices that can be very harmful to the respiratory tract, and this kid had underwent this procedure, and invariably these children die almost every time.
What did they do?
It's this thing where it's a throat scraping, where if the child
So it's like a local shaman or something?
Right. The traditional healer will basically kind of use his fingers or use an instrument to go and just kind of reach in the back of the throat and just scrape, and it causes lots of inflammation, lots of swelling, and you know, it's awful. And I only saw a few kids survive it, and they were, you know, older children, but the younger children always have problems. But you know, we were sitting there, and we did not have a ventilator, and the child was on their last legs, and we were there, just all we had was a bag, and just sat there all night. And you know, it's like, this is the only thing that we can really do. And you know, we took shifts staying up, and the mother even took shifts of keeping her child alive. And we knew that it was a hopeless task, but at the same time, you know, it was all we really could do. And I think, I don't know if that's a metaphor for life or anything like that, but it's one of those the realities when you're talking about international medicine. Sometimes you feel like you're so overwhelmed and over your head, but you still have to show up and just have to do the thing every day. And you know, the wins are sometimes few and far between, but the realities of the losses can sometimes be challenging, and that's why in international medicine people burn out quickly. You know, it's hard work over there. The number of patients you're seeing is much more. The presentation of disease is much later, and as such, your mortality rates are through the roof. I mean, our mortality rates on our wards were somewhere in the upwards of a quarter.
Yeah.
Everyone who we'd be in about a quarter of people would die. And I mean, that's not what we're used to here in the States. We're used to almost everybody living and surviving. And, it's hard when you're seeing your patients die every single day, especially children. And, but at the same time, there's those other cases that, do pull through and do well, and that keeps you coming back. I don't know. That was just one of the stories that came to my mind. Again, that was the downer note, sorry.
Well, I mean, I have a very similar experience when I went to Tanzania, Africa, as a third-year resident. I showed up there at this hospital, and the pediatrician left, and so for a month I was peds. And in this country, if a kid dies, we freak out. I don't know that I've ever seen a pediatric death here. Maybe some stillbirths, some early stuff, but I don't know that I've ever been there through, not a kid that doesn't have like chronic pulmonary dysplasia or whatever, but it's so commonplace over there. So in Tanzania at this time, it was malaria, a lot of malaria, meningitis, pneumonia. And I remember, and this is just sad, it makes me kind of sick to think about on so many levels, but I remember this one, kid came in, advanced presentation, super sick. We didn't know what the hell the diagnosis was. Was it because they were confused and out of it? Did they have meningitis? Did they have pneumonia? Did it advance? Was it malaria? All you know is fever, out of it, sick. And then the kid died, and here I am, like trying to consult mom and all this stuff. And I was told she may not be too upset about it. That's one less mouth she has to worry about feeding, And just the two different worlds where I had never seen kids die, and if they do, we freak out about it, versus they die all the time over there. And sometimes, I hate to say it's a blessing in that case, but it's less of a burden.
Yeah.
Definitely, there's a lot more death going on in some of the developing worlds, and it's definitely those populations are more used to it than we are. And I think that one of the things people would say, we'd often would do cesarean sections on pregnant mothers who needed it, and they were always kind of very happy after the C-section. And part of the reason I'm like, well, what is going on? Why are they so happy after the C-section? They were expecting to have a baby, but they said the expectation is if you're having trouble with birth, the baby's going to die. So every time we do this surgery, they're excited and wow, this actually works. So they were impressed that there was actually a positive outcome. That was amazing to me.
But that's their expectation.
Right, the expectation is, oh, well, you have a problem with birth and the baby's going to die.
Yeah.
But with a simple intervention that we could provide at our hospital, then we were able to save these children. To them, that was a huge deal. Here, it's commonplace. Of course, I have a problem with C-section.
One of the other sides, it's more intense. There's more death. That's harder. I remember when these kids died, I would feel guilt. What did I not do enough? What did I do wrong? Just a lot of questioning myself. Not to mention the whole just dealing with losing a patient. But then on the flip side, there's so many things that we do in this country. The number needed to treat is 500. If you give 500 people this pill, you might prevent one heart attack. And it's like, okay, good, I want people to be healthy. But then you go to the third world, or you go to Africa or whatever, the number needed to treat is 1. You give one kid a malaria pill and they will live instead of die. And if you're in the business of helping people and making a difference and saving lives, that's as good as it gets. You made a difference. And then you've got 30 of those kids there. I know that for me, I get off on that. That's like a high. Holy shit, I'm really making a difference. Now it's I remember this analogy when I was going through residency applications. This guy said, look, there's a river and there's babies in the river and they're floating toward this waterfall, okay? It feels great to pull them out and save these babies, but somebody needs to look upstream and either build a little fence so they stop falling in, or do some education or whatever, catch them upstream so that we quit having to do these heroics at the end. That prevention stuff. I totally agree with all of that. That said, it feels great pulling them out.
Yeah, it does. Well, Debbie Downers, I have a good story. So, my first time that I went to Haiti, which was before I met you, because I was there for like 2 days, because they had this massive political like revolt, and they sent us all out of the country.
Was this before the earthquake?
This was like maybe 5 months after.
Okay.
They actually like shut down operations completely for the NGO I was working for, and we all left, and it was super depressing. But I probably was in clinic for like 2 days, and there was this lady there, this elderly lady. We were in Port-au-Prince, and she had been like bit in her calf by a dog, like all the way through her calf, and it was terrible. It was, you know, she came back to, I think she came twice. She came the first day, and we like looked at her, and we didn't really know what we were gonna do. And then I asked like, what, you know, can we even do like anything to like debride this? And then eventually we did debride it. And I was like, I don't know, like she has like this like nasty like gauze on her leg, and now we're leaving, and she probably is gonna die of some like infection.
Or lose her leg.
Or lose her leg, or you know, I was like super like, that was one of the things I left. They kicked us out. Well, they didn't kick us out. They told us we all had to leave because it was too dangerous. And I went home and I was like, that was awful. Like I was there for 2 days. I saw, you know, what Haiti looked like and everything that was going on, and I felt like I didn't really get a chance to help. So I signed up again to go, and that's when I met you. Then it was, I don't know, maybe another 6 months later, and we were in Port-au-Prince, and there's like millions of people. Port-au-Prince is like super overpopulated. It's massive. And we were outside the clinic one morning, and this lady like found me. She recognized me.
The same lady.
Same lady. With the, she still had her leg, she was still alive, she like just gave me this big hug and was like thanking me for saving her leg, and it was pretty awesome. That was probably one of the best experiences ever. So
that is awesome.
Yes,
All in one.
yes, exactly. I like went home and I kept thinking about this lady, and then I actually ran into her again on the street. Like that's totally crazy.
I feel like there's a lot of times in life where you never know how what you did impacted somebody.
Yeah.
For better or for worse.
Yeah.
I like to hope most of the time when primary care, hopefully they follow up. You see them over and over. ER, you don't see them again unless they bounce back or they're kind of a frequent flyer.
Yeah.
Hopefully, those are great stories.
Pretty awesome. Yeah. Good feeling.
Saving lives, stamping out disease, wherever they may pop up.
Well, are we done? Have we ripped off enough?
Yes.
I think we have.
Maybe.
It's been good. Thanks for.
That's good. Sure.
How did you enjoy your first podcasting?
Super awesome. I feel like a superstar.
Was it everything you?
It was.
To all our fans out there.
Yes.
Well, how can they get in contact with you?
That's a good question.
Here, let me give them your home phone.
Exactly.
You can reach me at your own personal.
Well, Mr. Radio Voice, I think we need to cultivate this a little bit. But we didn't even talk about you being a marathon person and all that.
Yeah.
She's a marathoner and a gymnast.
Yes.
Gym teacher.
Maybe when you finally get on and go on American Ninja Warrior,
yes,
we'll do a podcast about your training.
Find me and vote for me, even though I don't think it's a voting type of event.
Show up and cheer you on. How about that?
Yes.
Team Talia. Hashtag Team Talia.
Yes, make it a thing.
Okay, good.
Yes.
Thanks for doing this.
Yes.
This is good. I think this is a good one.
No problem. This is fun.
We'll put it out there, and at least we'll listen to it. And I think you said your parents are going to listen to it, so that'll be nice.
They'll be highly embarrassed.
Force my mom to listen to it.
Yes.
She'll become your new fan, Larry.
That's true.
Hey, it starts small, but we'll grow from here. Okay, thanks for listening. We'll see you next time.
Yes.
Thanks for having us.
See you next time on the delicious dish. We're having
Careful, we're still recording.
sweaty balls.